Production begins in 5, 4, 3, 2, 1.
Hi, and welcome to United Way Update. I'm your host, Amy Leppins, Assistant Director of United Way of the Lower Eastern Shore. Joining me today is Pam Gregory, our Local Community Impact Director. Pam, welcome.
Hi, thanks.
Today you are here to talk with us about a big project that we have recently undertaken called the Alice Project.
Yep.
So first let's talk a little bit about the project in general.
Okay.
Who is Alice for those of us who are out there watching?
So ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. And basically this is a project that we, along with the other United Ways in the state of Maryland, came together and commissioned this report to be able to put some quantity and quantitative data around what we already anecdotally know, which is that well above the poverty level, there are still many, many families in our community that are struggling, and they're working. Some people consider it the working poor, but we're seeing a trend of the middle class shrinking, and so this report was able to give us, for the first time in Maryland, a chance to really quantify that data.
So Alice is most likely out there watching right now.
Absolutely.
You and I have been Alice at some point in our lives. Let's
Yes.
talk about who else would qualify as Alice.
So ALICE really comes to us from any demographic, any age range, whether that is a student coming right out of high school going straight into the working world, whether that is someone in college trying to make ends meet as they go to school, whether that is a young couple or a single parent family, and even all the way up to our senior citizens and folks in between. It's folks that work every day. They're working hard to make ends meet. It could be in any range of jobs, and we talk about that in the report. But these folks really are still struggling to meet the basic necessities and have a stability budget, if you will.
Okay, so ALICE stands for Asset Limited, Income Constrained, and Employed. So
Yes.
It's an important thing to note that these folks that are out there and struggling are employed.
Correct.
Can you talk a little bit about the type of employment that they might be facing?
Yeah, actually, the majority of the jobs in Maryland we discovered through this report are in the service industry. So cashiers, for instance, are the #1 employment in the state. Over 74,000 jobs in our state are cashiers of one point or another. Well, those jobs pay on average about $9 an hour. And so if you extrapolate that out, I mean, that's well under $30,000 a year gross, and net, of course, is significantly less than that. And that's simply not enough of an annual income for folks to be able to make ends meet every month. Other jobs that fall into this sector would include service jobs like waiters and waitresses, security personnel, and any other type of service organization type of work, which is many, many in our community.
Mm-hmm. I know when I was looking at some of the information, I saw administrative aides and administrative assistants,
Yep.
some of the types of professions you might find at the hospital.
Absolutely. I think across any of the different types of occupations in our community, from businesses large to small, public to private, government to non-government, there's going to be ALICE employees in every segment. Absolutely.
Even nonprofit.
That's exactly right. Yep.
As far as the total number of jobs in the state of Maryland, you said for cashiers it was 74,000. The total number is I think I saw around the $1.7 million or $7 million range.
It is, and of the top 20 types of occupations in Maryland, over half of them are these types of jobs, which pay at or below that $10 to $15 a range, or even below $10 a range, which can really impact somebody's ability to make those ends meet. And oftentimes they're forced into having multiple jobs. And we also saw in this report from an employment standpoint that there's a number of folks that are underemployed. So they may qualify or have the skills that could provide them an opportunity to have a higher paying job, but they don't have access to that type of work in the region where they live.
Okay. And so I know we had talked about previously, we've talked about this report a lot of these types of jobs, the cashiers, the service type positions, you've said and I know you have the statistics, but they're phasing out over the next however many years.
They are. I mean, when you take a look at the impact of technology on our workforce, I mean, whether you go to the local grocery store, the local Walmart, or any retail establishment, more and more self-checkouts are popping up. Well, think about that. That is someone's job. Even McDonald's now in the Eastern Shore are starting to put in the self-order kiosks. And so again, that is someone's job that's not being applied to by human resources. So there's a significant impact, and the report shows us that there's going to be a 50 to 70% reduction in the next several years, even looking out 5+ years, of those jobs disappearing because of technology. And so on the one hand, we think it's really great, well and good and fun to, be able to self-check out and this, that, and the other. And I'm just as guilty as anyone. I like the self-checkout because I can bag things the way I want them. But we don't think about the impact on somebody's livelihood when they don't have that opportunity to do that work.
And I'm guessing that applies to online purchasing too,
Absolutely.
rather than having to go to the store physically.
That's right. Online trends of shopping are more and more. We saw this through the holidays with the holiday season, the economic impact of that to local stores. I mean, that creates a pattern of, they have to reduce costs somewhere, and so they're going to reduce workforce. And it becomes a challenge of having enough other job opportunities and having also enough higher paying job opportunities to be able to meet folks' financial need.
So these ALICE families, ALICE asset limited, income constrained, and employed, the budget or the report takes a look at a lot of different thresholds and a lot of different budgets. So what makes up ALICE's budget?
So the ALICE budget and the threshold that's used to kind of determine where that cutoff is, if you're considered an ALICE household or not, is based on 5 major significant factors. And they're very, very basic standards, which are housing, transportation, child care, food, and a little bit for healthcare, health insurance. And there is a miscellaneous category, but it's really just for overruns of those other categories. It's not for miscellaneous like an unexpected expense.
Or going out to eat.
Or anything else. And, several things that are really missing in that budget are things like clothing, things like education expense. Almost everyone that's coming out of college has student loans, and that is a significant expense that they face.
Or savings for education.
Yeah, and it accounts for 0 savings. And so the ALICE households are really struggling to be able to put any money aside so that if their car breaks down or if there's some sort of, significant financial crisis, which could be just a few $100s, and that can really turn them upside down really quickly.
A really eye-opening little factor, some of the information that's been pulled out of the report, I know as we've met with certain government officials, they've found this to be very interesting, was the highest costs for laid out in the budgets for the ALICE survival budget. So what are the highest costs?
So for individuals, the highest cost is housing, whether that is a mortgage or a rent expense. Individuals are paying upwards of 50 and 60% of their monthly income just to keep a roof over their heads. And when they're having to shell out that much, it's really challenging. And then for families, for those with children, the number one cost is childcare. It's just as expensive as it is for childcare to keep a roof over your head. And when you're outputting that much, it creates this opportunity for families to have to make that choice. Well, does it make sense financially for me to work if every dime I'm making is going out to childcare? How am I getting ahead? And then that creates, a snowball effect of other decisions and situations for them. So it can be quite the challenge. There is data in the report that talks about affordable housing and the challenges that go into that. And we also make note of the fact that having that affordable housing near those job opportunities is also part of that factor, because while there may be a job opportunity, say in downtown Salisbury, if someone is living in a rural part of Dorchester or Somerset County, they may have a transportation issue and not be able to get to and from work. Or if there's a child care issue, but they work an hourly job that does not have flexibility or benefits available if they miss a shift, then their job is in jeopardy if they have to be home and take over the child, and it creates a mountain of issues.
I know this information is available for the very first time. This report has never been done in the state of Maryland.
Right.
We've always known that people struggle, but as you said, we've never been able to quantify the data. Talk briefly about historically, has the government looked at with the federal poverty threshold, and how is that report determined, and why is that report not as accurate as this Alice report is when you're looking at the struggling families?
Right. The federal poverty level has typically been the standard for, most government and social programs to use as a standard for defining, who is eligible to receive their social service assistance and their other programming. The methodology for the federal poverty level, which was established in the in the 60s, has been very rarely updated, and it doesn't account for significant cost of living changes, nor does it account for any localization and changes in cost of living from one market to the next or one state to the next, much less at a community level. So we were able to kind of take a step back and take a look throughout the state of Maryland at the county level and even the major municipality level on what it really does cost to live in those communities for these 5 basic areas in the budget. And it's just really eye-opening, because in most cases, in most counties, the very basic survival budget is twice that what the poverty level is. So the bottom line is that in the state of Maryland, 35% of the households in our state are really struggling to make ends meet. About 10% of that are those folks living at or below poverty, and it's another 25% above poverty, but still not even meeting this Alice threshold. And the troubling factor is here on the lower shore in our 4 counties, it's at 40.5%.
And when you say our 4 counties, can you define those?
Wycomico, Worcester, Somerset, and Dorchester. But the report was made for the entire state, and every county data is available in that report.
Okay. So let's talk about where the information came from.
Okay.
You said it was compiled for the entire state. Who led the project? How did we get the idea for the project?
Yeah, so this was actually a really neat initiative started by United Way of Northern New Jersey a number of years ago. They did this for their state. And it was such compelling data that a couple other United Ways, reached out to them and said, hey, can you help us do this? And in partnership with Rutgers University, they used a significant amount of data from the Census Bureau, the American Community Surveys, and a significant amount of other data. And so it's really grown and outreach to the point that now we were the 3rd cohort, a group of 4 states, kind of year after year, to come into this. And so by the end of this spring, 15 different states will have conducted this report under the leadership and guidance of United Way Northern New Jersey, as well as Rutgers, which is great. At the state level, we're one of 10 United Ways. Well, there's 12 United Ways in the state of Maryland, and we all came together as a steering committee for this. And we were able to garner resources, human resources, financial resources, to come together and be able to pull this off. Because individually, taking on a project like this would be out of the realm for any of us, but it's a great opportunity to collaborate with the other United Ways. So while we're all independent, it was a really great way to be able to have a state level and local impact at the same time. Further, we were very fortunate to have Beacon at Salisbury University, represented Dr. Sarah Guy, participated on the Research Advisory Committee for the state. So she was very helpful in helping to also review the data and mine the data out and make sure we were taking local factors into consideration.
So why, as a United Way, is it important for us to get behind this project?
Well, as you know, our basic fundamentals at United Way, the core basic building blocks that we believe that's going to make a community thrive is health, financial stability, and education. And so as a pivotal point for that, not only does this Alice report reinforce what we're doing from a financial stability standpoint and reinforce the need for programming and reinforce the need for additional program and expansion of services, but it also allows us in our health and education programs to see how those things are also affected. Because if a family is not financially secure, they are very likely having challenges from an educational standpoint, getting the training, work training, job training that they need. Perhaps they don't have the lower or upper education that they need to get into the workforce, so there's factors that need to be attributed there. And it's also very stressful, so very likely many of these families may have physical or mental health situations that also need to be addressed so that they can come together and thrive.
Okay. Let's get more into the numbers portion of this. You said earlier that the state of Maryland is 35% of the households in the state of Maryland fall at the Alice threshold or below. 40 0.5% in our 4-county area, Dorchester, Somerset, Worcester, and Wycomico,
Right.
fall at that threshold or below. Where can you dig into each
Yeah.
county a little bit?
Definitely. For instance, Somerset County is actually the highest in the state, with 53% of households are struggling. They have the highest level of poverty level, and they also have the highest threshold for ALICE households. Over half of the households there are really struggling. And anecdotally, and from a federal poverty level, that's something we've always known. But to have this data really reinforce that is really eye-opening, and it creates some very unique challenges for the Lower Shore, and especially for Somerset County. But each of other counties as well are anywhere from 35 to 40% as well. So therefore our average comes out to 40.5%. And it's really telling, because a lot of folks think, for instance, Worcester County, we have Ocean City, it's a resort population, but that actually creates a new unique set of challenges for us, because the workforce there can be transient. The workforce there also can be seasonal. And that makes a big impact on folks being able to keep those ends meeting every month.
So we know poverty level, we know the ALICE survival threshold, what families are just barely making to get by, or what that budget is, where they're barely getting by. Where do families, what do they have to do in order to be sustainable or stable?
So the report also extrapolates out a stability budget. So, we have federal poverty level, we have the survival budget that, X number of households aren't meeting, but the stability budget takes that a step further, and it adds some extra padding, if you will, some extra realistic data into those 5 basic categories. It adds an additional category for a cell phone. Because, if we think about it today, not everybody necessarily has internet access or has the ability to have internet access, but if they have a smartphone, they can at least access online applications, and they can do, basic online functions, which are completely necessary now. I mean, any job application these days, you have to go online to do it. And it also gives them a line item for savings, so that they can be putting away some money. And if, God forbid, that car breaks down, or they have a significant health emergency in their household, or some other, situation, then they can react and not be underwater instantly overnight. And it's important for folks to understand that that budget is in many cases almost double what the survival budget is. And we still have a significant amount of folks who really are struggling to meet that, even the stability budget. And a big challenge, we talked about jobs earlier, is that there's not enough jobs in the state of Maryland to pay at the rates where we really need folks to be able to survive and thrive at that cost of living.
And we know it's not a simple fix.
It's not, there's not one factor that goes into it either, right? Whether it is a situation because lack of jobs at a higher paying rate, whether it is lack of skilled workforce for those higher paying jobs that are available. It could be that those jobs are not located near where and have transportation issues to get to where they need to be for work. Affordable housing near those higher paying jobs as well. In our market, it's very, very rural here on the Lower Shore and throughout the Eastern Shore as a whole. And that creates a lot of challenges for those that don't have reliable transportation. We do have a mass transit system. It's got its challenges, and it as a rural environment, we can only outreach so far with some of our public transit. And so that creates gaps, and it creates a real challenge for folks to get where they need to be in a timely manner and be able to afford that transportation and get those higher paying jobs as well.
And now the question is, how do we move those ALICE families that are at the survival threshold up to the stability budget?
Yeah, and like you said, there's not one quick fix. There's not one overnight answer. It is, it is something where we can work as a united way in cooperation and collaboration with other nonprofit partners, other organizations that provide funding for, nonprofit programs, with government, with our educators. It's really something to bring everybody to the table and take a look at, and major employers as well, large and small, to take a look at what those challenges are and how we can meet those needs. It doesn't happen overnight. But, for instance, Warwick Community College has a tuition assistance program for folks that want to go back and to school and improve their work situation. Maybe they would like to get their CNA or their CDL license or something, and they really, they're working full time, but they really can't afford that extra tuition. They have a program that we support that allows folks to go back and do that. And so they can use data like this to say, do we need to expand the threshold for people that qualify for that program? Project Read over at the Wycomico County Library is a wonderful initiative to help people with all kinds of literacy challenges, not just reading literacy, but technology literacy and other educational-based literacy to help them improve their situation and be able to move forward.
And the programs that you just mentioned, Project Read and the Warwick Tuition Assistance Programs, they're not just Band-Aids. They are providing long-term solutions and sustainable solutions for the individuals that go through those programs.
Right. And we have several other partner programs as well that help meet those needs. For instance, Telemon organization here in Salisbury, based for the state in Salisbury, has a job training program for food service workers, and that's targeted to younger individuals who would like to get into the food service industry. And conversely, on the side of that, MAC here in Salisbury also has a senior jobs training program. So seniors who are retiring, but they really still need some financial assistance and new job skills can try to not only have the opportunity to boost their income, but it also helps them socially and emotionally to get out there and stay in the workforce at a pace that matches what they need.
Another partner of United Way's that I always like as an example of the long-term sustainable type programming is Habitat for Humanity.
Absolutely. The really awesome thing about the Habitat program is that they're not only helping folks get a roof over their head, the families that participate in that have to put sweat equity in and actually help, wield the hammers and get the roof up. But the more important part is the amount of financial stability coaching and financial management coaching and training that they put the opportunity in front of for those families. They have to show that they're going to be fiscally responsible, that they understand how to manage with a mortgage and how to be able to get on their feet and budget, et cetera. And they really give them the tools that they need to continue to sustain that once they move in.
Well, I know we've been doing the circuit a lot. We've been, as a United Way, we've been going out and talking with various government officials, different civic and fraternal organizations, and trying to just get the word out about this report as much as we possibly can.
Absolutely.
What do we want people to do with the information?
Use it. We can't just have this report be a 200 pages of light reading and go in somebody's drawer. That's not what it's for. The report's available, as you know, on our website for anyone in the public to access anytime. They can download it and enjoy some light reading, but it is there to be used. So whether it is a social service agency, government or private, nonprofit, anybody looking to say, what programs do we need to identify to help our community? Or whether it's a nonprofit applying for funding from different foundations and grantors, they can use this as data to help show the need for that programming. Whether it's government showing that they need to expand maybe additional social services, et cetera. And it's not necessarily expansion of services as much as it may be looking at an expansion of the folks that can qualify for those services and what those requirements are. But there's a lot of folks that need some help. And it's important too, if someone is watching and they're like, well, I must be an Alice. I'm working and I'm really struggling week to week to make ends meet. Please know that it's okay, and that you can reach out and try to, get assistance through these organizations and also through the 211 hotline.
So for anybody who doesn't know what that is, can you explain it?
211 is a 24/7, 365-day hotline. It is, you call 911 for an emergency, but 211 is for information and referrals. So here locally on the entire Eastern Shore, actually, it is manned by Life Crisis Center, and anytime you call, you will get a human, not a recording, and they will very graciously be able to listen to your situation and help provide referrals and resources that can help meet your needs.
And they have a database of thousands of organizations.
They do.
And they can
Statewide.
connect you right over the phone.
They can, depending on if the organization is open, but depending on the hours of the day, yes, they can provide those connections and also make those soft connections where they stay on the phone until you get there.
And I'm glad that you said that about anybody who's watching who thinks they might be in this situation, because they can also always reach out to our United Way as well.
That's right. We're happy to provide some referrals and resources and guidance as well. And also just for the general public, you know, a big thing too is if you're not sure what to do, but you'd like to help out, reach out to your lawmakers, reach out to your local folks. If you're involved in a nonprofit organization yourself and you'd like to kind of think, well, is there something we could do to help make a difference? Have these conversations, you know, get familiar with the data. And if you're familiar with the data and you're familiar with the work of your organization, then hopefully you can help be part of those conversations to improve life for everybody here.
Great. Well, is there anything else you want to add that we haven't touched on? You're the expert.
Well, like I said, it's a very large report. And so, you know, trying to condense that much information down can be daunting at times. But I really just kind of encourage folks to go online to our website, which is unitedwayforus.org/Alice. And you can download and read the entire report. There you can access each of the 4 county data pages. The full report also has county pages if you're interested in the other regions of the state. But just help be part of the conversations. And if you are interested, if anybody is interested in having us come and talk about the report further to their group, feel free to reach out to us, and we're happy to do that. We don't want this to sit in a desk. We want this to be something that is active and conversational and a tool for improvement.
And you are the expert, and you will come out 24 hours a day, 7 days a week, right?
Okay.
All right. Well, thank you, Pam.
Thanks,
Pam
Amy.
Gregory, the Community Impact Director of United Way, was here talking to us about Alice today. If you have questions about Alice, or you just want more information about United Way of the Lower Eastern Shore in general, you can find us on our website at www.unitedwayforus.org. And be sure to watch PAC 14 streaming live at www.pac14.org.
Would you like to see your community organization or nonprofit group featured on PAC 14? To get started, contact us at 410-677-5014 or visit our website at www.pac14.org. PAC 14 is a great way to connect with your community.